I think for us in vascular surgery, it's mostly going to be about activity tracking and promotion of exercise and trying to help patients reach their optimal health goals. There's been a lot of literature in the last year about the overall health benefits of exercise, significant impact it can have on almost all domains of health. And one of my faculty colleagues, Dr. Alva Alami, has started a company with an app called VasTrack, with the idea being if we do an intervention for claudication, rather than asking the patient how much further they're walking, we can actually measure how much further they're walking. And claudication, it's always been difficult to assess what the real impact of the resources we put into treating claudication, how effective that is. And by being able to track performance, we can guide patients if they can do better, or we can talk about patterns of exercise, intensity of exercise, frequency of exercise, and most importantly, we can get a value on the services we're providing for these patients, rather than the subjective effect of, you just had a procedure, can you walk further? Probably down the road we'll be able to monitor aneurysm progression if we can identify biomarkers or some other, something that's a surrogate for a diameter or even something beyond that. Another one of my colleagues is working on a device that would look for evidence of stroke while you're sleeping, because you're sleeping a third of the time, and if you happen to have an embolic event or something in your sleep, if your EEG patterns change, if you're at risk, for example, if you have atrial fibrillation and you're having trouble meeting your anticoagulation goals, it'd be a device that will monitor your sleep EEG patterns to look for a possibility of having a stroke. So I think it's mostly in monitoring and outcome assessment, at least in the next near period, as well as kind of encouraging proper, appropriate, optimal exercise and health patterns. I think, in Silicon Valley, where we live and work, most patients are fairly welcoming to technology. In fact, a lot of our patients work for technology companies, so I think, I don't see a huge problem there. I think other parts of the country and perhaps other parts of the world, there's going to be concerns about accuracy, expense, appropriateness, privacy, reliability, reproducibility, all those types of issues. That's true for any new technology. But I do think that particularly vascular surgery and vascular disease management is well suited to this type of outcomes assessment that I think wearables are going to be able to provide. This space is really proceeding rapidly, so the SVS is working with VasTrack to get a branded activity tracker app on your phone that will help both pre and post intervention. So we're looking at rolling something out actually this year, and once it gets used in a demonstration project like Apple's My Heart Counts, we'll get a much better idea about how applicable it's going to be to the treatment of vascular disease.